I was still pretty nervous because I'd already had it done once.
17 years after traditional bunion surgery, Monica Nicely found herself consulting with an orthopedic surgeon again, this time for a longer-lasting solution.
Lapiplasty is permanent, and so if you look at her x-rays, her before and after, one of the things to take into account is something called the sesamoid positions.
Sesamoids are small bones under the big toe that help it move while absorbing the impact and weight of walking. This advanced surgical approach allows Dr. Putnam to realign those bones and repair the bunion in all 3 dimensions.
So we know that if you line up the sesamoids properly, your recurrence rates decrease by 10 to 12-fold.
I needed it to line up with life because I have kids and obligations too. I mountain bike. It is a passion for my kids, and they need a ride and they need a partner. So if I can't do it, then it's harder for them to do.
Dr. Putnam is the first foot and ankle specialist to bring Lapiplasty to our region.
Well, I liked Dr. Putnam. I felt like he was easy to talk to and be honest with.
Just 3 months after her Lapiplasty, Monica returned for her final follow-up visit with Dr. Putnam.
She can get back on her bike, she can exercise, she can do really whatever she wants.
When I left his office for the final time, I felt good. I felt like I was ready to put my foot to the test, and I was not concerned about whether it would hold up or not, and it has done great.